Welcome everyone back to the Transforming Inner Pain mini-series, where you'll hear inspiring stories of hope, healing, and triumphing over adversity. So today it is my honor to have Mindy here with us, who actually is my sister, and she's going to recount her experience and journey with polycystic ovarian syndrome, PCOS, and how it impacted her early in life, causing emotional pain, physical, and mental health challenges. She has embarked on a journey to find a holistic approach to managing her PCOS, reduce stress, and find happiness. Through avid research, yoga, inner work, meditation, nutrition, exercise, mindful living, and more, she has learned how to take control of her health, transform her life, and find the confidence to ditch her job and start her own business. So Mindy is the proud owner of Minderella Designs and Events and Alluring Artistry LLC here in Wisconsin. She's a women's health advocate and obviously the co-author of Embracing the Journey, which we will discuss more later in the interview. She has been a thriving entrepreneur for over 8 years, where she has been bringing her creativity and attention to detail to both the wedding and beauty industry through both of her businesses. As a wedding planner, designer, and florist, Mindy has assisted numerous couples through the wedding planning process and helped turn their wedding dreams into reality. With Alluring Artistry, she brings her skills into the beauty industry by offering specialty beauty services as a certified eyelash extension technician and a certified permanent makeup artist, offering cosmetic tattooing and permanent makeup services. So phenomenal. Welcome to the mini series, Mindy. I'm so glad that you are here with us today.
Thank you for having me.
You bet. So why don't we go ahead and dive right in? Why don't you give us some details about your story and how you got to where you are today?
Okay. So I chose to share my story about PCOS because it's been a journey that I've been on since before I was a teenager. And I'm in my 40s. And there are so many women out there that are experiencing women issues with PCOS, endometriosis, reproductive health, infertility. And I just remember looking, thinking back to when I was a teenager or a young adult and what I was feeling and what I was experiencing in my body. It's been a very transformative experience since then. But I want to share with other women that there are ways to feel better and that there's hope.
Yeah. And so a little backstory, both my sister and I, we both struggle with PCOS. And so it's, we experience some of the similar issues, complications with our bodies and what have you. So it's something that obviously I know very intimately as well, and can, empathize with what my sister is going through. And it has been quite a journey, to say the least, when you have these female issues. And the problem is PCOS is so undiagnosed accurately. And there's a lot of women that receive the PCOS diagnosis that really probably don't have it, but because it's not, how do I want to phrase this, Mindy? Like it's well known, but it's not at the same time. It's difficult to actually diagnose who truly has it. Is that correct?
Yes. So I'm going to take kind of what you were saying. So I feel with the medical field, PCOS is so, I don't want to say that it's rare because it's becoming more prominent in women today. But like you said, is it really PCOS that they're having, that they're being diagnosed with, and those are the issues? Or is it just something else? And because PCOS is just coming around, I would say, in the medical field and I don't want to say like recent, within the last couple of years, I'm talking within the last 10 to 15 years.
Yes.
More research is being done and more studies are being done, that I feel like there's like these blanket symptoms that if you're having XYZ, you have PCOS.
Yes.
When really, I think PCOS is very individualized, and there's specific markers that indicate that you do have polycystic ovarian syndrome.
Yeah, because even between you and I mean, we have we have some similar symptoms with PCOS, but then at the same time, we are also at the opposite ends of the spectrum on some things. So even for us being siblings and having the same diagnosis, our symptoms aren't 100% exact,
Exactly.
so it's challenging. And, thankfully we can work together and we can talk about different things that work for us and supplements that we take to, really help manage our symptoms holistically, because that is the approach that we both wanted to take. We didn't want to, let's be honest, we were both on birth control pills to help manage it and regulate our cycles and what have you. And we've done other things throughout the years. And I was diagnosed with PCOS in my very early 20s, and I'm, in my late 30s. So it's been something that I've been dealing with for a long time. And I have endometriosis. So you can add that into the mix. And it's, it's a hormone, just catastrophe over here with us.
Mhm.
So, it's not something that I was just diagnosed with. It was something I was diagnosed with years ago. And even in my very early 20s, gosh, I don't even know if I was even in my 20s yet. I think I was around 18 or 19 when I was first diagnosed. But there wasn't a lot of information about it. It was go on this birth control and this will help manage your symptoms. Well, sorry, but it really didn't. They were trying to throw a Band-Aid on it and try and fix it, and it really wasn't fixing it. And then that led to me having other health issues, me struggling with infertility for 9 years, and really going on this whole journey of trying to figure out just how to understand my body and how I can support it myself and really understand it, because no one's going to know your body better than you, right? And so tell us a little bit about your journey, because you've embarked on this journey and you've really dove headfirst more into all of this, more than what I have. So tell us a little bit about what you've done, what you've discovered, things that are really working for you in helping you manage a lot of your symptoms. And even share with us, for those that don't know what polycystic ovarian syndrome is, why don't we talk about some of the symptoms that we have, or some of the markers, or the markers that we have, or more common markers that people have.
So in a nutshell, PCOS, polycystic ovarian syndrome, it's an endocrine system disorder that directly affects your hormonal system. Mm-hmm. So most people think hormones are just strictly women related, but men have them too. Mm-hmm. And the thing with hormones is when one of them is not in balance, mm-hmm. it causes other hormones to become imbalanced as well, which can cause a plethora of issues within your body. So some of the common symptoms with PCOS are irregular periods. So because of the hormonal imbalance, your system has difficulty ovulating or producing that egg. So what happens in turn is that it turns into a cyst. So your ovaries can become basically cyst laden, and which can cause issues with your reproductive system, fertility, even pregnancy. If you do become pregnant, it can cause some issues during your pregnancy and birthing. Some of the other symptoms would be, a big one is prediabetes or insulin resistance. So that's when your body doesn't recognize the hormone insulin, which is a requirement for our bodies to, insulin is the key that unlocks the cell to use that food as energy. So when your body doesn't recognize it, it's like you're eating this food and it's not even, doesn't recognize it as food. So what it does is it turns that food into storage or fat. So
which is why a lot of women have extra midsection areas where we're a little bit more fuller at our bellies when we have PCOS. And it's interesting, I don't even remember who I was talking to, but we were talking about diabetes in the family. And long story short, there's 5 girls of us in the family. Mindy and I, both with PCOS, do not have diabetes, but our 3 sisters and our late father are diabetic. And it's interesting how we are at higher risk for the diabetes because our dad had diabetes and because we have PCOS. Like we are like way up there. in terms of high risk for being diabetic. And so it's interesting for me to look at that the two of us that are the highest of risk to be diabetic are not diabetic. And I think a lot of that is attributed to our lifestyle, the way that we eat, the mindfulness that we have around our PCOS that's really helping manage it and reduce our risk because, oh my goodness, I mean, so many women are diabetic that have PCOS, and it's unfortunate, but it's interesting when we look at our family dynamic and we look at our health issues that the two of us that probably should have it really don't have it. So let's talk a little bit about the foods that you eat. You have I don't want to say that you have a strict diet. You have a very mindful way of eating that helps fuel your body properly and helps balance out those hormones. So what are some of the things that you do with your eating?
So with PCOS, my PCOS is insulin resistant driven, which means my body doesn't respond to insulin. And eating it's recommended, I should say, medical professionals have recommended at this point that, and I've known this too for forever, but to eat a low carb diet, because the reason being is your body doesn't process foods properly like a normal body would. Specifically your carbohydrates, those, your pastas, your grains, your breads, your sweets, your sugars.
All the things I love.
Yeah, everything that's good, everything that tastes good. But it doesn't process those foods, and in turn turns into weight gain. So years ago, when I was first diagnosed with PCOS, I was put on metformin, which was another one of the Band-Aid medications that many doctors put women on for PCOS, and it's specifically to help. It's to help with blood sugar, to balance your blood sugars, which is where the insulin resistance comes into play. So knowing that they were recommending this medication that was supposed to help with my blood sugars, I wanted to get to the root cause of everything that was going on with my body, but specifically what I was putting into my body. So it's recommended at this point that women with PCOS or dealing with hormonal issues, it's best to follow a low carb, low sugar diet, especially no processed foods, all the things that we like to eat. And so right now I follow I don't want to say strict, because I'm not strict with it, and I do allow myself to splurge every now and then, but it's being very mindful about the amount of carbohydrates that my body can accurately and efficiently process. So right now, over the years, I've done, a lot of trial and error, a lot of tracking, food tracking, elimination diets, things like that. And I've gotten to the point where I know what foods my body can process efficiently and what things I can't. So it's just being very mindful about, eating the foods that I know my body can process that are healthy for me, and, really limiting the things that are going to negatively affect my PCOS symptoms. So another thing that I wanted to add in is dairy. Dairy is just not good for women with hormonal issues because of just the nature of what it is. It has hormones in it. So reducing my dairy was a big thing, which is hard because we live in Wisconsin and everything has dairy in it. So
everything.
Everything. So the reason they recommend, to limit your dairy is because it specifically can increase your androgen hormones in women's bodies with PCOS, which means you're getting more of those male hormones. And for me, I deal with hirsutism, with excess growth, hair growth, especially on my neck and my face. So I've noticed when I started to reduce my dairy intake that the hair coming in was slowing down and it was thinning out. So there's there's a direct correlation of what you're consuming and what you're putting into your body, food, even products, makeup, chemical, things like that. It directly affects your hormones, and it's just being really mindful about what you're putting in.
Yep. And I know for you and I, we've been on this journey of trying to eliminate as many toxins and chemicals as possible over the years. And it's a process. I mean, it takes time, because when everything that you have that you put on your bodies, everything has chemicals. So when you start your cleaning products, your beauty products, everything, you don't want to waste it and just throw everything out, because, you've purchased that stuff. So you want to use it, but at the same time, it's like, you want to get rid of it. And then you're trying to find, ways to be able to change those over and get those non-toxic chemicals. But, that's something that I recommend, even to my clients, even if you aren't struggling with PCOS, it's like, we need to move back into the era of where we didn't have all these chemicals and all the toxins that are coming in, because literally everything that you put on your body, anything that you are eating, everything is laden with chemicals and toxins and stuff lately, and it's not healthy for you. And that's where, in my opinion, I feel like we've seen really the increase in the rise of a lot of different health issues, a lot of different cancers and things like that. Because, let's be honest, if you're putting something on your skin's the largest organ of your body. What do you think it's going to do? Right? It's going to absorb it, and it's going to go right into your bloodstream and everything else. So, trying to transition away from all these toxins and chemicals has really been, a key thing for both of us as well, is really just adapting to that holistic lifestyle and being more natural in things that we're doing. And I mean, let's be honest, Mindy and I, back in the day, we used to have all of our makeup and our hair products, and we were like divas back in the day, and now we are both pretty minimal with the things that we do. And it's just because we have a different perspective on life, and we know that if we take this approach and clean out a lot of the garbage and the crap in our lives, that it's going to help overall with our health and our overall wellness and, our well-being. So,
when you feel good, you can do better.
Yes. Yeah. And all of those things just contribute to the cause. So why not try and, eliminate the things that are going to cause triggers or cause inflammation, or, whatever the case may be, changing our hormone levels, even if we think about, if we look at dairy, for example, or even a lot of our meats, a lot of the animals are now being injected with hormones. So where do you think is going into those hormones? Those hormones are going into the meat, it's going into the dairy, it's going in that, that's being used for the cheese and what have you. So it's literally filtering down to us. So now these animals have more hormones that are being injected, and that's getting put back into us, and we could even go on a whole tangent of how even young girls are now starting to have their first periods very, very early. And I mean, early. And a lot of that is attributed to the added hormones that they're getting from the foods that they're eating. So, which is really scary when you think about it, because could you imagine? I mean, being not much older than my son, Manny, he's 6. There's young girls that are starting to have their cycles when they're 7, 8 years old. That is
scary,
mind-boggling to me that is where we are in this stage of the game. So I'll get off my soapbox, but anyway, I digress. Really consider, looking at the toxins, looking at the meat that you have, the foods that you're consuming, and really evaluating what you're putting into your body, the products that you're using, because it all is being absorbed and it is going to impact your health. Whether you have PCOS or not, it is going to impact your health. And so really take a mindful look at that. So thank you for sharing that. I know there's been a few things that you've done in terms of like exercise and whatnot that have also helped with your PCOS. And I know over the years, like when you were younger, you struggled a lot with, with your confidence and the body that you had, because it was, you were trying to embrace the body that you had, that you were given, and you didn't really know, you didn't have the diagnosis back then. Right. So let's talk about that a little bit briefly, about your journey with really building your confidence and learning to love the body that you have, and how that started from where you are to where, from where you were to where you are today, and share a little bit about that experience.
So I haven't always loved my body. That's
Well,
for sure.
well, who has?
Yeah, who has? But growing up, I was always heavier.
Mhm.
As a teenager, I was always bigger, and I was very self-conscious about how I looked and how clothes didn't fit me how they should.
Mhm.
Um,
Let's be honest, the clothes back in the day were not flattering by any means for
no,
anybody.
no, it's definitely come a long way. But as I got into, like my late teens, early 20s, um, I dealt a lot with um, body image issues and lack of self-confidence, and it really impacted my anxiety and my social
Mhm.
anxiety. I didn't want to go
Mhm.
anywhere. I didn't have clothes that looked good on me, and I didn't look like the other girls. So
Mhm.
um, I started working out. I think I actually started doing just some light, like aerobic exercises and just walking,
Yeah,
being on
and
the treadmill.
I think you had the weighted ankle.
Yeah, the ankle weights.
Yeah, you had those that you did
Yeah.
for a while that you do your walking. I remember those.
hmm Yeah. And I mean, I was always active. I was
Yeah.
always active.
Mhm.
I was never a kid that was sitting around. I was
Yeah, God,
never,
no.
I
We
would,
didn't sit around at home growing up. We were always active. We were
yeah,
outside doing stuff, running around with the kids.
yep,
We were in sports and stuff. I mean, yeah, you were active. I mean, I can attest to the fact that we were
yeah.
active as kids. Like you didn't find us sitting around the house unless we were
hmm
reading a book, and
Yep.
even then we were probably outside reading. It wasn't that
hmm
we were inside. We were never inside. We were always out doing stuff.
So I started working out, and despite my efforts, I mean, I toned up a little bit and I lost a little bit of weight, but I still wasn't happy with my body. And
Mhm.
it wasn't until, I mean, let me back up a little bit. I've consistently been active
Mhm.
all my life. Like I'm talking, even back then, I was probably doing 4 to 5 days a week of exercise. Now I'm every day.
Mhm.
And what changed and how I was able to kind of flip my mindset was just kind of really taking a step back, understanding what was going on with my body. Um, Getting my stress under control was the biggest thing.
Mhm.
So, as we know, stress causes cortisol, which is
Uh-huh.
a hormone. So,
Yep.
with excess stress being built up into my body, I had excess cortisol, which
Mhm.
was, affecting all the other hormones too. So, I wanted to directly address my stress.
Mhm.
And it also made sense to me that I was doing too much exercise for my
Yes.
body. I was stressing my body out.
Yes. And
With,
I'm glad that you mentioned that because I was going to bring up that too.
yep,
So keep going.
yep. So that was part of it too. So I had to really take a step back with
Mhm.
my movement practices
Mhm.
and stop doing so much. And what I did, I started with yoga.
Mhm.
And it's funny because we're all on so many different journeys, but my yoga journey specifically has changed tremendously. When I
Mhm.
first started doing yoga, it was it was for exercise. It was my a form of exercise.
Mhm.
And now I know all the different steps and all the, everything that it entails, and I use it for so much more. But slowing down, incorporating breath work,
Mhm.
um, journaling,
Mhm.
meditating, just completely taking a step back and slowing down
Mhm.
really helped, I think, kick off my, I don't even want to say weight loss because that doesn't even really make sense, but it helped balance things out within my
Mhm.
body, within my stress levels. And it allowed me more energy to put towards efforts that were working. So I could do more yoga. I could incorporate
Mhm.
2 to 3 days of hit workouts, high intensity interval training. I didn't have to be doing it every single day. I didn't have to be
Mhm.
lifting weights every single day. It was just kind of finding that balance that worked for me, that allowed me to release that stress and also build strength, which in turn helped me lose weight and tone up. So am I where I want to be? No. But I'm a lot happier with my body. I can appreciate what it can do, what it does for me on a daily basis. I mean, it carries me through my day. So, it's been a long journey, but I am definitely more in love with my body as a whole than I was ever.
Yeah, and I can definitely see that. I mean, obviously growing up as siblings, obviously, I knew where your confidence levels were way back in the day, and I can definitely see where you are a lot more confident in who you are now, even if you're not at your goal weight, even if you can look in the mirror and you can say, oh, I have all these imperfections and I just don't like, XYZ about my body, but you still love the body that you're in. You're grateful for what it can do for you. And that is a really powerful thing in your healing journey and in the acceptance, when you can look at yourself or look at your situation. And even though it's a thorn in your side and you wish you didn't have to deal with it, but you can accept it. You can be grateful for what it is, what it has taught you, what you've learned from it. And you can learn to live with it or learn to deal with it. It's really part of that healing journey. And so many people, when they're on that healing journey, they don't take those steps. They're not willing to face the facts of what situation they've gone through, or, whatever it may be for them. They aren't willing to accept that. They're not willing and open to being able to start that healing journey. They're not expressing the gratitude for, even though it may be a really difficult, challenging situation that they're in. But you know what? I firmly believe that in any situation, you can find something to be grateful for, always. And when you can change that mindset and you can find something that you are grateful for, even in that difficult situation, it's going to open the doors for other things to happen. Your mindset is going to shift. Your perspective on life, your perspective on that particular difficult, adversity that you're facing is going to shift. And by doing that, you're opening those doors for you to heal. You're opening those doors for you to really transform, your life and take things to a different level. And, when we're looking at in terms of, us women, let's be honest, so many women really struggle with looking at their bodies, accepting what their bodies have gone through, what they have done. I mean, even for myself as a mother, Lord knows my body does not look anything like what it did years ago. And even for me, I am still on that journey of being able to look in the mirror and love my body the way that it is, because it's completely changed. And you have to really learn to, embrace it. You have to learn to accept it. You have to learn to appreciate it. I mean, just from my own experience, struggling with infertility for 9 years, and then miraculously finding that we conceived, just that in and of itself, with dealing with PCOS and endometriosis, and knowing that I was able to carry my child and have actually a normal, healthy pregnancy, is pretty miraculous. I should be grateful for that, right? I mean, my body was able to do that, and I may or may not have more children down the road, but I have my one, and my body was able to give me that blessing. And so, as much as there's times I look at my stomach, I'm like, oh, I need to lose this extra weight that's down here in my midsection. I don't like all my stretch marks. I've got scars from, I had to have so many surgeries, but they tell a story. They tell a story of my journey and the things that I have overcome and what I've been on. So I want to, at least for me, leave that with you guys, is look at the journey you've been on, find that blessing, look at how far you have come on your journey, what you've already been through. There's so many times we don't appreciate the things that we've already gone through, what we've overcome, because we're so focused on we're not there yet. We're not perfect yet. Our bodies aren't there yet. Whatever it is, we're not there yet. Nothing's ever enough. But appreciate what you've already gone through, because you've gone through a lot. You've overcome a lot. So celebrate the fact that you've done that and appreciate the lessons you've learned along the way, as difficult as they may have been, but really, really embrace that part of that journey for you. So I think this is a really wonderful place for us to kind of wrap things up. So why don't you share with us, what advice, what tips, what would you like to share with anyone that is struggling with, their confidence, struggling with the way that, they're loving or not loving their bodies, or those that are struggling with PCOS, in their health journey? What would you like to share with them?
I would say, what I mentioned earlier is that PCOS is so individualized for each person. What works for me may or may not work for somebody else. And you might find something that doesn't work for anybody, but it's working for you. That's okay. I think the biggest thing is just being your own advocate and knowing how you want to feel, and just kind of having an understanding about what's going on in your body so that you can talk to your medical professionals about what's going on and the approach that would work best for you going forward. And I think the biggest thing with that is if your doctor or medical professional that you're seeing is recommending something that you're just not feeling is right for you, it's okay to go and get a second opinion and to talk to somebody about what you think might work good for you. Because like we mentioned, there's so much information out there, but there's
not
so little information. So I've done countless hours of reading and research and following different people online who really align with my views on PCOS and my healing. And I know for a fact, my doctor, probably the one that I used to see, if I were to say to her, hey, this is what I'm following, this is what I'm doing, she'll probably be okay with it. But I know she's going to try to draw me back to the treatment plan that she and I had planned, had put together years ago. And I hate to say it, it wasn't doing anything for me. So I took it upon myself to do that research and, really find out what's going on in my body and the things that I wanted to change. And I just focused on that every single day. And, as I'm getting older, my hormones are changing. So it's a learning experience.
It's super awesome.
Yep. So I would say just don't give up, and that there's hope. It's not going to be easy, and you do have to put forth, effort, but there's enough resources out there and tools and solutions to help you feel better inside.
Absolutely. So basically, we want to make sure that we are our own advocate. We want to make sure that we are open to other healing methods in your journey, because what works for Mindy and I may not work for you. Even for her and I, we have different things that work for each of us because our bodies are so unique and different, and our PCOS symptoms are, while they are the same and similar, we have very different ones as well, and keep at it. Don't let this weigh you down. It can be a challenge, but there is hope. There's light at the end of the tunnel. You can, with trial and error, find things that work for you. So just be open to it. Be patient. It's not going to happen overnight by any means.
Definitely.
By any means, definitely. So, and make sure, something that I want to share with you too, is as you are working with a medical professional, definitely find someone that is willing to work with you with your beliefs, your viewpoints, your values. And if they don't, find someone else that is huge and going to be pivotal in your healing journey and you getting a handle on whatever health issues you may be having, whether it be outside of PCOS, but definitely if you are having PCOS, and making sure you're with someone that wants to get to the root cause and not just throw a Band-Aid on it. I know for me, when I switched doctors and I went to someone that was really about getting to the root cause of things and really looking at everything going on with my body, things really changed for me. And that really opened my eyes. And it was a catalyst to the healing and in the journey that I was on with myself, and same for you. So definitely take that into consideration as you're doing that. All right. Awesome. Well, thank you so much, Mindy, for being here and sharing your story about how you have transformed your inner pain and overcome adversity. I'm really honored and excited that you shared that, and I was able to add my little snippets in there throughout the journey. So for those of you that are tuning in, as a reminder, all of these stories that we are sharing as part of the Transforming Inner Pain mini-series will all be included in the upcoming anthology, Embracing the Journey, where over 10 brave women share their stories of hope, healing, and triumph over adversity. And that book releases on July 15th. Now, the exciting thing is I also have a book that's releasing on July 22nd, Transforming Inner Pain. Ta-da! Imagine that, right? And as a bonus to my book, when you purchase a physical copy of Transforming Inner Pain, you will receive an ebook version of Embracing the Journey as a bonus, free as a thank you for supporting me in my writing journey over the years. So I'm really excited for both of those to release and for me to be able to share so many incredible and powerful and empowering stories in the anthology that they are truly amazing and they will change your life. So I'm excited to share that with you in the coming weeks. So thank you guys so much for tuning in. Again, thank you for Mindy for being here.
Thank you.
And you're welcome. And until we chat again, have a fantastic day and we'll see you next time. Bye.